In this, we're talking about acne. Acne is a chronic inflammatory condition of the skin, and it's something that I've had a particular interest in throughout my career. It's a condition that affects the pilosebaceous follicle, which is the little hair that comes out of the skin and the associated oil gland that's attached to it. And the sequence of events when you develop acne is, number one, the oil gland starts producing too much oil, and the oil production is controlled by male hormone. Now, male hormone is always normal in men, even with acne, and in 70% of women with acne. 30% of women may have a slight increase of male hormone due to polycystic ovary syndrome. The increased oil production gives you a slightly greasy skin, but the key to the whole thing is a growth change of the skin cells that grow just at the entrance of the hair follicle. And this causes a partial plug. This restricts the oil flow, so the oil then dams up under the skin, and that encourages the proliferation of a particular bacterium called Cutibacterium acnes within the skin. What then happens is that the body develops an inflammatory reaction to that. We know from work that we've done in our own laboratory that this is due to a T-cell response to the bacterial antigens. This then encourages literally pus cells to come into the follicle and will eventually develop into a pustule. It can affect the back, the chest, and in serious cases, I've seen it affecting the upper arms, the torso, and even down on the legs as well. When it's very inflammatory, it can be painful, and in the most serious conditions, it can cause systemic upsets with fever. As far as incidence goes, almost everybody will have had some form of acne in their life. Current treatment of acne really relies upon the use of antibiotics, and these can either be topical as creams or gels, or taken as oral tablets. And the problem there is concern about drug resistance to antibiotics. And we know the drug resistance to the antibiotics is increasing massively. The other issue is with the really powerful drug called isotretinoin or Roaccutane. This is a drug that is still seen to be a cure for acne, although it really isn't. 50% of people will relapse after having a course of Roaccutane, and it can have very serious side effects, which tend to be almost disregarded by medical science, which is crazy. We know that it can cause mental problems, it can be associated with suicide, and it can now be associated with sexual dysfunction. So it is a drug that should be restricted in its use and is far too widely used in the UK. So what we're developing at Derma Biosciences is, number one, an agent that will kill the Cutibacterium acnes that is purely plant-based. This will also have anti-inflammatory effects, and that can help reduce the inflammation as well as killing the bacterium. The second string is to use products that will reduce the oil production in the skin, and this we've almost perfected. We have agents that will reduce oil production by up to 50%, and that once again will have a great impact in reducing the buildup of oil within the follicle, and therefore reduce the whole risk of the inflammation developing.